Okay. Oh, I'm up first. Happy New Year. Happy New Year. We have set ourselves a terrible goal for 2024. We have to beat 2023. Those of you who are at our holiday celebration on December 20th know what a great year that we had last year. I'll just give you the highlights and then we'll jump into this month's program. Highlights from 2023. 6 new portfolio companies, 22 checks written, 1.3 million put to work on innovative startups. Give yourselves a hand. So thanks to Michaela, we have excellent presentations today. She put together this PowerPoint. Okay, so the lower button, presenters, is your advanced button. Thank yous are in order. A lot of folks are aware of the network effects of the Michigan Angel community, but did you know that there actually is a Michigan Angel community? It's a little pocket 501c3 that exists purely to coordinate the dozen angel groups in the state with a grant from the Ralph C. Wilson Jr. Foundation. So some of the deals that you have seen are then going from Pointe Angels to other angel groups. Some are imported from other angel groups. It's actually more of the former, since we do such a good job of member scouting, of getting referrals from Pointe Angels members of companies that wouldn't have shown up in deal flow otherwise. And then also Varnum Law, who is our sponsor in 2023 and looking to be in 2024 as well. We're really grateful to Varnum for the support that they've given us and this important announcement. You're going to hear stuff in this room that this room is a public forum. But once we get into diligence, you're going to learn a great deal about companies in the spirit of investing in them. And it's either the Chatham House rules or the Cambridge House rules, I can't remember the actual term for how we have to hold that information in confidence. As investors, we may or may not sign NDAs, but as players in an ecosystem, we are bound by certain ethical and integrity constraints to use the information for the purpose of investing.
Good.
And that was obviously not a legal statement. What a great program we put together. Many kudos to our security team for putting this together. InsureVision and NuShoulder are previews. We'll get 5 minutes to tell you a little bit about what they're up to. Then we'll jump into our main course, VERN AI, a full venture presentation. We saw a preview from them last year, and Avana Health, who we also saw a preview last year. So that's the track from previews to venture. And then after venture, we have updates. So a portfolio company, Ecovia Renewables, Kusei Said is here to tell us all the great things that he's doing with our money, and Electric Fish, an update presentation on one of our previews from September. And we'll finish out with some portfolio news. This is the format, and we got 90 minutes to get through it. So without further ado, I'd like to invite up Mark Miller, who's visiting from London.
From London, England.
Mark, you have 5 minutes. Please tell us what you're up to at InsureVision.
Okay, well, good evening, everybody. And firstly, David, thank you for the invitation. And what a pleasure it is to come to such a fantastic country club and to meet you, ladies and gentlemen. So I thought I'd just introduce by telling you a little bit about myself. I recently sold my previous business. It was a speech recognition and clinical noting business. It's the largest business in Europe. We provided a service for an AI-based solution for documenting patient doctor notes. Brought me into the AI industry relatively early, 2014, 2015. We had an 18% market share. I sold it for, well, only in dollars because sterling changed quite a lot against dollar over the recent past, but somewhere between $35, $40 million. And I was speaking to Kurt, who I met earlier. I said one reaches an inflection point in one's life. I'd done it at 39, and I had to do an earn-out period. And I looked at, well, you either could retire reasonably on that or take on another challenge. And I really wanted to do something in the car sector because so to come to Detroit is a great pleasure for me. I collect vehicles, but I put the personal thing to one side. I'll tell you about what InsureVision is doing. We produced a crash prediction model, and so we work on two problems. One which is vehicles crashing, and the second one which is the ability to long-term estimate driver risk. And the foundational technology that we use is something called the transformer. The transformer is most widely known in its GPT iteration, which is the generative pre-trained transformer popularized by OpenAI. We use what I call a PVT. That's not a word you can find. PVT often means an Indian company, but I call it predictive vision transformer. And so transformers are really, really powerful, the latest generation of AI, and they think about everything in the past as an analytical method of AI, an understanding, and everything going forward is predictive or generative. So what we do is we give you as a driver a real-time action alert, and we're going to tell you you're going to crash a car in 4 seconds. When you crash a vehicle, as a driver, you have 2 things you can do. You can change your direction, or you can change your speed. Tends to be in a car crash situation from the road scene or just the way you're driving, you tend not to change direction. So, but if I tell you, like, in 4 seconds' time you're going to crash your vehicle, it gives you a good opportunity to reduce your speed, pay more attention and cover the brake, and that will either reduce the damage of the claim in the accident or stop it altogether. Attendant to that, we have what we call a driver embedding. And so, an embedding is an idea, you tend to hear the word embedding, so these are ideas that are well established in other areas of machine learning. And so that's a kind of a vector embedding. It's a representations of all styles of driving within our embedding structure. And so when we observe you driving, we understand, well, look, you drive like that group within our vector, and that links fundamentally to that probability to crash, and so your long-term risk looks like that. So those are the 2 problems that we're solving. A little bit on the company today. So I invested the pre-seed about $500,000. Again, you know, this goes up more than I would like. Sterling goes 1.2 to 1.6 against the dollar, so it's all over the place. But call it $500,000. And with that money, we produced our model. We put a team together. We built our own edge device. We're a software company, but we wanted to be able to put the product in a car now and show it to people. And we've achieved a POC, a big POC with one of the big, I can't give the name, but a big US carrier, very big US carrier. We're putting out 1,000 cars in 3 states in 24. And that's kind of our signature, I suppose, milestone achievement to get that. And I'm very, very pleased about that. We've also had some strong interest in OEMs, tier 1s, and from one of the very, very big e-commerce providers for fleet logistics. And so those are kind of the 3 areas that we're looking at. I'm conscious of time, so I'm going to wrap this up. I want to just mention my AI colleague. I worked in speech recognition, clinical speech recognition. Speech recognition, modern speech recognition, neural speech recognition was really invented by one person. It's a British research scientist called Dan, formerly of Cambridge, latterly at Johns Hopkins, now neither of those institutions. Dan and I got to know each other in speech recognition. He's done 3 years in Transformers. In the world, you know, he'd be the top 10, 15. He's a well-known scientist, 50,000 citations. It's his model. So we implement his model, and it's a state-of-the-art framework that we've written completely. It's not something you can download on GitHub. In terms of coming to America, well, for an English or British team, we've come increasingly to regard the American market as the determinative market, the great market. And so to be a success, you have to be a success in America. So thank you very much. And if anybody would like to speak to me later, I'll do my best to answer questions. Cheers. Thank you.
And thank you for hopping the pond for us, Mark. Thank you for having me, by all means. Next up, I should say, Mark is here because John Schmatzer recruited him. NuShoulder is here because Ed Kreese is their tireless booster.
Bit of an ad.
Yeah.
So at this point, are we going to run a slide? Are we going to run a video? What do we do?
Slide and
first.
video.
Slide first and then video. Okay. You got this?
Yes, I got this.
All right. So Ben and team from NuShoulder Ben, your 5 minutes begins now.
Yep, my name is Ben Reagan. I'm the CEO of NuShoulder, and this is Dr. Ken Cervoni, the founder of NuShoulder. Ken brought me on 18 months ago to create the go-to-market strategy. 50% of you in here, statistically, in the next 2 years, are going to have a debilitating shoulder injury, and the system is broken. We really concentrate on the America, especially treating the injury instead of preventing the injury. So the last 18 months, we've gone to these athletes who are the most elite athletes that have played their sport. We have Hall of Famers, 2-time Cy Young winners. Not only did they use our machine, they became champions of our machine. And what's really important is if it's good enough for them, then it should be good enough for everybody else in here. Dr. Cervoni says, I didn't make it for these people. I didn't make it for the University of Michigan football. I made it for you, Ben, and everybody here so that we could have a golf swing that was pain-free, play another season of pickleball. So one thing that we really need to do is prevent these injuries, but we also have to educate people on the importance of strengthening the rotator cuff. And that's where I'll hand it over to Dr. Cervoni.
Thank you, and thanks for having us. Think of the shoulder as a ball and socket, a big ball and a little socket. It's inherently unstable, and like a golf ball and a golf tee. So you need a big protective hug from the rotator cuff to keep it stable. It's the hero of our story. The villain is our deltoid. The deltoid here works against the rotator cuff. So we want bigger protective hugs so that we can prevent injury, lessen pain, and have better performance in our athletes. So the holy grail is not treated like it in therapy. And the reason is because it's so time consuming and very technically demanding to train the rotator cuff, set up all the 4 to 5 stations to train the 4 muscles, and then isolate it from the deltoid, which we don't want to train. So NuShoulder's fix that problem. We have a 5 exercise machine, sit down for all the exercises, push the button to change the weight, don't even have to get up. Very convenient, which improves compliance. The design is such that you train the rotator cuff perfectly. Perfect form, it demands it. It won't let you do it incorrectly. Why is that important? Because we want to train that rotator cuff. It's the hero, strengthen it, not the villain. It also has a weight system that's the exact same amount of weight throughout the entire arc of motion, which is far more efficient, far more effective, and safer training. You can't get that with fans. We have a built-in dynamometer that tests the strength. We push it up to our NuShoulder app where we can identify deficiencies and muscle weaknesses so we can alter and adjust our protocols and create new ones to target the weaknesses to balance the shoulder, because a balanced shoulder is a safe shoulder. You can also take your rotator cuff strength and measure it in your peer group, like comparing your peer groups. Why is that important? All D1 quarterbacks, rotator cuff strength. We know that preseason weakness of the rotator cuff is directly associated with in-season shoulder injuries and elbow injuries, and shoulder injuries requiring surgery. Why is that important? Because if you have a shoulder injury out a couple days, that's one thing. If you're out from surgery, it's a season, maybe a career. Coach Ben Herbert, strength and conditioning coach, U of M football, recently told me, availability is better than ability. You can have the best quarterback in the country. Doesn't matter if he's injured, he's on the bench, he's not helping anybody, right? So J.J. McCarthy, 2 years ago injured his shoulder, was on our machine, used it, still uses it. He won the starting job. He's played every game, never missed a game, no shoulder pain. And the players, his teammates call it JJ's baby. They make a joke of it, but that's his baby. So he's been using it all along. They have 3 machines. They want 7 more. Coach Ben Herbert says NuShoulder gives him availability. We take that data I talked about before. We push it up to our Shoulder Connect app in the cloud. So in that community, our members are now directed to resources that they can use to make them better athletes. We're not just a machine, we are a system. We want our athletes to enjoy longer, more productive, enjoyable careers. Okay? We want physical therapies outfits to be able to deliver better care to more patients in less time with less staff. We want everyday lay people to be able to have the same elite rotator cuff training that the pros use. Here at NuShoulder, we're here to help people treat their shoulders better, and we're doing it like nobody's done before. Thank you.
Thank you.
If you could do it, but 40 seconds. 40 seconds, please.
No, we'll do it.
We'll do it. Here, he's gonna do 40 seconds. That's right.
Without further ado, and thank you, Ken.
Thank you.
First met Craig Tucker through Michigan State University there. Michigan State Foundation, Red Cedar Ventures, and Michigan Rise have funded a number of the companies that have come through here. And did we first meet Craig at Undemo?
No, I'm actually not sure, David. I think you just reached out.
It might have been, I might have poached you, yeah. Love what VERN is doing. I'm a little bit familiar from having done sentiment analysis, which is like the tip of the iceberg that VERN plunges. We saw a preview from them, went screaming through screening, probably because of the great updates that you've been sending us all along. So for those of you watching at home, do the updates. They're super important. The down button is your advanced button.
Okay.
You have a lot of back matter to get through.
Sure do.
So without further ado, 15-minute presentation followed by 15 minutes of Q&A with Craig Tucker and his team from VERN. Your time begins now.
Thank you very much. Thanks, everybody, for the opportunity to speak with you. My name is Craig Tucker. I am the creator and co-founder of VERN AI. It's motion recognition technology. So, how many of you have had a problem with customer service? All of us, right, at some point in time. Well, have you ever stopped to think why that happens? Well, it's because the companies actually don't understand you as a customer. They don't understand how you feel. They really have no way in order to understand if you're going to be happy, you're going to be sad, or you're going to be joyful. And for good reason, because what we found is over 70% of enterprise customer experience interactions are a complete black hole. And that's a problem with your reputation, especially with one person can go on and ruin your reputation and tank your brand. So you do so, you ignore the audience at your own risk. And the reason is because of sentiment analysis. Now, sentiment analysis gives you positive, negative, neutral, and mixed. And it's really good at that, but it doesn't ever tell you anything more than that. And what's causing is the companies are having to spend around $1 million to enterprise level to run sentiment analysis just to hire another team of people to analyze the analysis. Well, it's madness. The solution to that would be manual review, but that is extremely labor intensive, and companies and enterprises don't have the wherewithal to cover the manual review. So that also introduces our next problem, human bias, which we will see in all of our competitors. Sentiment analysis has failed, and that's the reason why we created VERN. VERN AI can help solve the problem. So it helps to reduce the customer attrition and adds more to your bottom line. It increases the customer engagement and also increases the positive customer experiences. With VERN AI, now you know all about your customer because they're actually telling you how they feel. The reason it's different is because we use emotion recognition. That's a different technology than sentiment analysis. It detects distinct, salient emotions, as you can see on the screen: anger, sadness, fear, joy, humor. So now enterprises can know when a customer is happy or sad. They can now intervene with a customer when there's a problem instead of waiting until they've lost the customer, because you do have an opportunity to address an upset customer before you lose them. And of course, it eliminates the need for customer surveys, because why would you have a survey at the end of your conversation when you're actually getting the information from them in the conversation you're having with your clients as you go? So basically, it completely eliminates that need altogether. So VERN AI is built into chatbots and virtual assistants. We've also been able to leverage it into live interactions, including interviews and using in counseling sessions. We've been doing pilot testing and therapy, and it's also in award-winning mental health applications. So as far as traction, we have 2 patents from the U.S. Patent Office, and the third one is on the way. Last year were named the winner of Core AI's Botathon for our bot that actually helped to diffuse angry customers and allow them to get to a live agent and take care of the problem. We're also the foundational technology for the award-winning application Evermore. Now, Evermore Last year won the Webby Awards, and the year before that won the Anthem Awards for the best responsible use for technology. And just to let you all know a little secret, there's something coming up with the Ronald McDonald House in Evermore that they'll be announcing in the next few days, so we're all very excited about that. In order to kick off our go-to-market, we started this fall. We were named one of the top 20 AI startups by AI Dev World. The conference booth out in California. We went out to Silicon Valley, Sam and I did. Met a lot of the big players, and we are still wrapping up negotiations on those first sales from that, and we still have quite a bit left to go. All right, so our market rollout strategy is pretty simple. We're going to go after the customer experience market because we already have a beachhead there. One of our channel partners is Core AI. They're one of the world's largest chatbots and virtual assistants. But in addition to that, we are also adding Amelia AI and OneReach AI, which will give us 3 of the top 5 chatbot and virtual assistant companies as channel partners. That allows us to leverage ourselves into the employee well-being market because after the customer service, we might want to use this for our employees and human relations and actually prevent burnout, which in turnover, which is a big problem. On the way to the digital mental health and digital health market, which we've already started to work with the appropriate stakeholders and with government on. It just takes a lot of time and a little extra capital. Oh, that's the wrong way. All right, so our go-to-market is really simple. We're going to connect, we're going to offer, and we're going to sign. So we're looking for businesses that are medium to large-sized businesses with a call center. Every CEO we've met with and we've talked to, and those that are in the industry that have talked to the other CEOs, tell us this is where the biggest cost lies. This is where everybody wants to be able to cut expenses because the call centers are so labor intensive. We'll offer them a 1-month pilot that we can actually control the engagement, prove the results, and add a rider that will automatically kick in a 1-year annual contract, which will then allow us to sell our API and consulting and development services. Because one thing we've found when we spoke to everybody is that everybody wants VERN. Everyone. We've had nobody tell us no. Well, the problem is they don't have the capability to add VERN to their system. So we did that. We have on-staff developers, some of the best in the area, software developers that can actually build in solutions for these companies. These bespoke solutions we're just talking about range from about $50,000 from the paid pilot to about $1.1 million on an annual contract, and that's pretty much the whole ball of wax. Personas, journeys, everything that they're going to need to know to individualize their particular type of care. For anybody and anyone, you can use VERN right now. We have an API that's open and available. Developers are using it. Monthly billing is around $3 for 1,000. That's a little bit over the sentiment analysis tools that are out there now. We feel we have bigger value. And in distribution, we also have signed Eden AI and Gravity AI as AI marketplaces that are into the AI ops market. Into AI, you understand how computing works. A lot of times we're cobbling together software now to create a solution. So we're about $2,500 plus to $10,000 each per month from them. That's what we're looking at. So our milestones. So our feature rollout will open up these following markets. VERN Voice we'll be actually getting to in about Q2 2024. We've partnered with a company called Cobalt Speech. Jeff Adams, one of the creators of Amazon's Alexa, and has created an emotion recognition component that works really well with VERN. Actually, I just spoke with them today. We're well on the way to having a full voice product out in Q2, which will obviously give us anyone with call centers or with voice. As you can see here, cities already told us they wanted this type of product, Amelia Core AI. Then we're going to move into the visual, because what we want to do is we want to build a full multimodal emotional recognition software, complete with the language which underpins all of our emotional communication, which we've proven, the audio signals from Cobalt Speech, and we're going to be working with Pointe AI and John Heath and his company to create a visual recognition system that will allow us to add the facial clues and the expressions and the body language, which will finish out full multimodal. That obviously is very interesting to our friends Cloud Machine, who we're working with currently. They can use that to analyze broadcasts and sports shows. YouTube, which can actually use that to moderate content. Now they will be actually forced to do that by the federal government, and if they don't, they will have to pay huge fines. And we've already spoke with Microsoft and TDK. Actually, that was part of the show out in Santa Clara. They approached us and asked us to get into their API ecosystem, which we're currently working on. And then, of course, it's a killer application for any type of Zoom conference tool. In the future, we're also working on personas, which actually enhance the understanding of those emotions based off of a frame or an individualized level. So what this does is it allows these companies to actually understand the emotions that you feel and can actually proactively address you in the way that you prefer. This is obviously very interesting to Sparrow. They've already told us that Core AI and VERN AI will be excellent for the patient experience and for their wayfinding. And as soon as I get the merger over, we're in. San Ysidro Health has said that they don't understand when people are happy or sad. And Acrisure and eBay, Salesforce obviously are very interested in more individualized data and analysis. All right. The competition, VERN AI has several different competitions. Just about anybody that does sentiment analysis would be considered a substitute, but not in direct competition. A little bit about the companies that are up there. BrainWatch does social media analysis. Cognigy is basically is an analytics as a service company that also offers sentiment analysis. And Google, well, everybody knows Google, right? The thing is that VERN actually beats BrainWatch because it's actually above a 60% it's above 80% accuracy, right? So BrainWatch only gets 60 to 70%. Cognigy has problems with voice analysis in real time, and Google is not accurate at all. It doesn't work in real time. It has a tremendous amount of problems, but yet they still are making millions of dollars a year selling their sentiment analysis tool. The core team, myself, I'm Craig Tucker. Brian Novak is our CTO, and it represents experts in emotion, software development, conversational AI. In fact, Sam Jabeli-Devan is a former vice president, conversational AI. Go ahead and say hi, Sam.
Hi, Sam. Hi, everyone. So I wanted to just give you a little blurb here about everything that Craig is saying and how I feel about it. I've been in financial technology for 23 years. I've been working in AI ML and took the first chatbot in finance to scale in 2019. And it was a great experience in doing that through Citibank. I wanted to join Craig and the VERN team because what they're doing and what I'm hoping to help them build on, and what you will hopefully get on board and work with us on, and make change happen, is actually be able to in real time understand people, customers, and reflect their emotions in a way that empathizes with them, improves retention, engagement, and spend, reduces cancellations and attrition, and creates a closer bond between customers and the enterprise in real time, 24/7, and actually cut out a lot of the existing core tools and a lot of the manual interventions that are going on right now, which are essentially not helpful. So I was really blown away by that. I personally needed this tool when I was at Citi, and I was like, get me on board, this is amazing. So, thank you.
Please, Sam.
Thank you, Craig.
Yeah, absolutely. So that's part of our core team. Anybody feel free to come up to us and ask us a little bit later. So what we're looking at is, because we have such high demand, because we're at the point where sentiment analysis is failing, because we're at the point where we're having executives of Fortune 500 companies already telling us that 70 to 80% of their data is worthless, we feel that we have an opportunity to hit a home run. This could be a foundational technology to the future of computing. The previous age of computing was cognitive. This was all basically just based off numbers and figures. The next phase of computing likely will be the affective phase of computing, where you actually have interactions between human beings and computerized systems being able to understand and react directly. Now, we've shown VERN to everybody who's actually paying for sentiment analysis right now, and they've all told us the same thing. And VERN is the holy grail of customer service, because VERN provides empathy. So what we're looking and asking for is, so we're going for a $1.5 million raise at a $7.5 million valuation, and it's based off of comparable businesses, right? We're going to use it for conventions, conferences, trade shows, targeting all of the small businesses, because what we've done before here is we've laid the solid foundation for VERN AI. With all of the different partners we've worked for, all the way up to being the top 20 startup. And what we're looking at here is starting out with Cobalt Speech, it's going to be the voice partner. We've had discussions with General Motors about showing them how they can use emotion recognition to better understand their customers. And we've already spoken about Amelia and OneReach AI are both coming on as channel partners. We have proposals to Clout Machine. Speaking with Jets Pizza, City has already said that they want us for an engagement. Former CEO of Acrisure shared the office next to me. He already wants us in there, and so on and so forth. And all this, everybody, is in the last 4 months. All right, so basically since we've met with you, we've met with all those folks. No, the demand is insane. You should see our schedule and our calendar. It's just really only going to grow because sentiment analysis has finally hit the wall we predicted. Return on investment, everybody wants to know the exits, right? Well, Effectiva sold for $73.5 million in 2021 for their detection software. It wasn't really motion detection, by the way. Clarivate sold for $1.12 billion in 21 to Qualtrics. Qualtrics thought they had the be-all, end-all of with sentiment analysis. It was going to solve all the problems of customer services. Surprise, it actually doesn't. And then RepuState, a small player, sold for $8.4 million in 2023, showing you that there's absolute value within the market itself. We want to leave you guys all with one thing to really remember. Humans are emotional. Humans use computers. Computers cannot understand emotions. Therefore, wherever a human and computer meet is a use case for VERN.
Wow.
Thank you for your time.
Talk about bringing it in on time. Thank you, Craig. Questions for Sam and Craig? Ed? And then Craig.
On your, on the spreadsheet, did I see that you were gonna have $4 million in revenue this year?
We actually predict that, yeah.
What's your revenue for 23?
We didn't have any revenue in 23.
Oh, so you haven't booked any revenue? Okay.
Yeah, we're just starting out. That's based off of the conversations we have, and we'd love to show you the numbers and
Okay.
all the projections.
Yeah, almost the same question, but what's your current run rate? How much revenue do you have in this month?
We're still pre-revenue, so
Still
we
pre- so
probably
still
a couple
pre-revenue.
$100 is what we're doing right now.
Okay,
So you're gonna go from 0 to 4 million by December?
That's reasonable, yes.
Okay.
All right, so now a little coaching.
Yep.
Flip the investor question. When they hit 4 million, what will you do?
I will invest.
That's free.
If they hit 4 million by December,
Okay, a question. Why is Core AI so important? A lot of us haven't heard of Core AI.
Sure.
That's a channel partner, which usually means you're pushing string. Talk us through the Core AI relationship and why it makes $4 million this year.
Absolutely. Well, I can do it. Sam, would you like to jump in, or do you think I can? Go ahead. Okay.
Take
yeah.
some.
All right, so Core AI has 350 enterprise customers currently on the market. They handle over 1 billion conversations, and they are by far the leader in the Gartner quadrant. Magic Quadrant. Thank you, David. For chatbots and virtual assistants. Sam used them at Citi. He was the first person in the world to build a fintech bot at scale, and then developed it with Core AI, through Core AI, in their system. Now, it's not just Core AI, Dave. There's also OneReach and Amelia AI as well. Now, all of those companies are the same size, if not bigger, than Core AI. And adding those as additional channel partners adds an additional 350 to 500 customers enterprise level for each company that we add in as channel
Is
partners.
that 350 conversations or 350 flip the switch, make the money?
Flip the switch, make the money. Because what we'll do is we have integrated in with Core AI currently. Any Core client can take our module, put it in, sign up for my API, and they're using VERN.
Okay, and I knew that. That was a softball question. David?
Okay, so on traction, you talked about patents, but how do you know this works? How do you know you're greater than 60% and greater than 80% accuracy?
I'm glad you asked, because before we went to market, we had to prove that out. So we went on, we did pods, Michigan State University's Federal Credit Union. They told us that it's 80% accuracy or better on their customer data. We went out and we worked with Boise State University's GIM lab to make an AR, VR app for kids with autism. The results came back off of that it's above an 80% accuracy rate based off of the researchers that told us. Our good partner Evermore IO, the one that's winning all the awards, they also reported back about 80% or above accuracy level. And what we do is we constantly test it and we challenge everybody to beat it. In fact, we had a challenge earlier this summer and we asked somebody who could develop a software that could actually beat VERN AI in a test. Somebody took the challenge and it was somebody took ChatGPT 4 Pro version and tried to beat it with that. Turned out the ChatGPT can't even get the same result twice, right? So that's absolutely not
So you
valuable.
truly, in the academic research, they compared it against the
Yes,
competition.
my background's in academic research. Our director of research is Dr. Brendan Watson. He literally wrote the book on content analysis. So that's who we have on staff that helps us to train. And we also use to test against a company called, or an organization called WASA. They are an organization consortium of about 23 different academic institutions that come up with an index of what they think these emotions are, because everybody's trying to find this question, right? What are actually these emotions? They're very accurate, but they conflate sadness and anger in some of their studies. So we know we're actually probably more accurate than the human teams themselves, which is ironic because as our Dr. Brendan Watson likes to say, it's like, here we are using humans to create a Kodak and create a rubric for computers to go out and code, and then humans are there to verify, and at any point in time there can be bias. Any point in time there can be bias laid in, right? So it's one of those interesting things is that we always have humans as part of as part of the cycle. That makes sense.
What? So if you hit 80% with the pilot with the Michigan State Credit Union,
Yes.
are they converting to a customer?
They are not. They went with Boost AI. They're a different bot company, and Boost did not want to bring us in. So that was why we're not with MSUFC.
So is that, so your sales is still kind of the channel partner, pretty much relying on?
No, actually we're doing direct sales ourselves as well. So the channel partner gives us the ability to get into the room and to talk with the folks that are already using the tools and already finding the problems that the SAMs found and we knew they're gonna find. So we have a wrapped audience for just about anybody that we talk to. So not just the channel partners, which are great, but we're also doing direct sales like with LG, Sam? Some of the
Yeah,
others.
no, I mean,
Airship.
I think to answer that holistically as well, I think the different stages of the evolution of this product went from we've created this model to now we are a full solution and digital transformation partner. So we've got everything you need. So we shouldn't be in that same situation again with a company like Michigan State or whoever will come in and say, we'll make the whole suite for you, the full stack. Don't think of it as just emotion recognition. We're going to be your AI partner, period. So yeah, the channel technologies we'll use will be reliable, but one of them will be ours.
And we only had anger and sadness at the point we did the pilot in Michigan State
Yeah.
University. So they were helping us build the model up and prove that model out as we were doing the detectors, so.
Following on
Right.
Ward's question and kind of bridging back to Ed,
Mhm.
how much of the pie is this bespoke business where you're having to actually build it out with your own developers and that's a service to onboard? And how much of it is the switch flip with one of the channels?
You know, that's the thing is what we're finding is even with the channel partners is the bespoke is a big part of this. So that most of the companies, like Blue City for an example, they've cut a lot of their staff up. They
I
don't
was
have the
afraid you were gonna say
capability.
that. All right, so how do you scale the bespoke?
Well, I mean,
Well, the API
Building-
doesn't need training, so it does work out of the gate. But
Your bespoke developers are using the API.
yeah,
That's
but then
fine.
yeah,
Okay.
but then after that we want to do the added value. So
Jimmy?
yeah.
In the channel partner network, right, so you have access to their network and their clients, but who's selling it? So just because you have access doesn't mean somebody's gonna sell it or buy it.
right, we're selling it and they are too. So we actually are working with their sales teams, their healthcare sales team.
What's the incentive for them to push your application opposed to theirs?
They know they have a problem with sentiment analysis. I mean,
What's the
we're-
revenue incentive for them to push your stuff?
Well, they can go to another bot. They can go to another system. They can abandon Core AI because they're not getting what they were promised.
No, no,
It's a
no.
tech play, not a revenue play for them?
No, the split bit for us and the channel partners. How much do
Oh.
they get and how much do we get?
Oh, okay. It all depends, based on what type of engagement it is. We bring them in, you know, we get a larger percentage of the take than they do. We have a deal for a referral, we have a deal for, which is basically commission-based. Then we have another level deal where we actually do implementation for them, because we're all trained as core AI
Wouldn't they
bot
bring
learners.
you in, in case you said you bring them in?
It's both ways, it works both ways. So we talk to clients that want to have solutions, core AI is one of the solutions we offer. Then what we do is we bring those sales teams in to talk to them. When they have issues and things that they want to have built up, and they get a hold of us, we're currently working with their health team to try to develop some healthcare bots and basically solve
Jimmy, are
problems.
you asking about channel pull-through?
I understand all this stuff, but I'm
Sure.
saying that if you look 5 years out, are you gonna be more of a back-end underlying technology that's, so you're all back-end, like more like a white label, or are you gonna have any brand power? Like, is anybody ever gonna buy from you directly? It feels like you're channel dependent. If so why would you be sticky, for one? I mean, great technologies is there or not. But it feels like you guys aren't, you don't have control over moving the needle. It seems you're dependent on the channel to drive your revenue. Unless I'm missing something, I don't know.
Yeah, no, a couple of things. I mean, the questions you're asking are the ones we ask ourselves, right? Where's our moat? How sticky are we? How dependent are people on us? One of the key things to pick up here is we have these patents. No one else can do what we do without breaching our patents. No one else is doing what we do today without relying on their old foundations, which was sentiment analysis and broken psychological models, which have now come under scrutiny because no one can test psychological models successfully anymore. That's the psychology crisis. So the foundation is wrong on all the stuff that they're doing out there, of the known brands. Everyone else we're talking about, like Core Amelia and OneReach, they are coming to us and saying, we know we've got sentiment analysis, we know customers are going to be asking about emotion recognition soon, we want you to do that for us. We're going to compete behind our back to build something better, so to speak, but in reality I don't think they're going to be able to do that. So that's part of it. Second part is that because we're going to be aware of and know those other platforms which are now becoming commodities, Amelia, Core, and OneReach are commodities. Emotion recognition is not. So we are the ones who can then build the full solution using any tools, inclling someone else's in-house.
You not relying on patents as much as you think. And you need traction more than patent protection, in my opinion.
Right, fair enough.
Especially today. I don't think they mean that much. I've been fucked up patents.
I'm sorry.
I'm just telling you, I
No, I
wouldn't
appreciate
put
it.
all your eggs in that basket. There's a lot of
No,
women.
I
Oh, yeah,
understand.
absolutely.
But we do have the what do you call it? We do have the readiness. We're ahead of most people in the market, and we undercharge compared to, say, a major company that says, take my full solution worth $100 million. We can charge you anything from 50 to a million, like 50,000 to a million. We've got the scale prices. So the way we look at it as well is we're a cheaper solution at a premium price than sentiment analysis, but way cheaper than if you had to go deal with a big guy and get the stuff done and deal with their inflexibility as opposed to our bespoke solution.
Kurt and then Scott.
Yeah, excuse me, thanks for the presentation. Well done. Sorry, so I didn't catch the relationship between the competition slide and the acquisitions slide, the exit slide you showed. But you mentioned that one of them thought they had the market kind of cornered or the leading solution, and they got the capital to make billion-dollar acquisitions. So what is it about VERN that gives you an actual advantage over a company like that has tremendous resources to develop and to push a product and all these things? So what is it that gives you?
Well, I think first of all, when they bought something they thought they had, and then it turned out not to be what it was promised. I think that when they bought Qualtrics bought them, the Clarabridge, they thought sentiment analysis would solve these problems because, Kurt, you got to remember in 19 he built the world's first bot, right?
For financial
For
services.
financial
Scale.
services.
And
So
sentiment
it was-
analysis was a dream even back then.
Right, it was a dream. So they didn't even really know in 21 what they had. Now that we've had a lot of these companies and enterprises have actually been using these products and finding that it's actually not answering the questions because we're being told that 70-80% black hole from a number of different organizations and enterprises.
I do want to emphasize this.
Sure.
I deployed a sentiment analysis model that we created at Citi, thinking we've done it, we've finally done it, this is great. Deployed it to the model of the bot with 100 million conversations coming through, and it was useless. Like most of it was unhelpful, did not actually create a proactive experience for our customers because the analysis of the analysis and the paralysis that came after that was meaningless. Whereas when we are able to actually say something much more meaningful than sentiment analysis, we can actually proactively what do you call it? Make our customers happy.
Scott, and then Sukhinder.
You may want to reject this question, but my background in, say, sentiment analysis is no background. So if I'm a customer of your company, conceptually, what might I be doing today, and how would that look different if I brought your tool into my business?
I'll give you an example. So, for example, a customer, you specifically have a specific use case, like say, I'll use a banking one, you're trying to make a payment and it's not working for some reason. We have an error, usually it's error number 5678, and it's an esoteric error. What chatbots do and what help guides try to do is turn that into English. But if I know from measuring the way you've had conversations with our chat agents, call agents, customer service, and so on, and the chatbot, immediately when you have that error, how you're actually feeling, I'm not going to answer the question to you in that same robotic tone. I'm going to say, this guy seems angry, let me try to appease him, make him feel good about what's going on, and work with him on that. If you're sad, I'll answer it a different way. If you're happy and you seem pretty cool with it anyway, I'll be more casual with you. That can be done in real time. That's one thing. Secondly, when you call us repeatedly and talk to human agents, we can track that in real time and go, we know how you're feeling 3 months ago, 3 weeks ago. Looks like the way you're feeling is matching those who are trite. Let's try to catch this person, not on the third call when they're saying, I want to close my account, but try to catch them on that 3-month cycle. So suddenly you're changing loser situations for the company into winners. So that's how we would change your life as a company. We would turn sad, fearful and angry situations into joyous ones for you proactively for your customers.
So capture a situation before an angry customer fills out a customer satisfaction.
We wouldn't even need to do that. We would stop it before you called us and say, I want to leave, and then we have this retention team come and try to save
Thumbs
them.
down doesn't do any good.
Right.
It really doesn't.
Sukhinder?
Going back to the potential exit question, who are your potential acquirers? NICE, Salesforce, do you want to comment on one of those or either?
Yeah, I mean, Salesforce, we already actually are in conversations with them about our technology. We're bringing them in as vendors as well. So that's definitely part of it. Microsoft, Meta, we've had discussions with them. We're actually starting to talk with them. So there's a lot of really nice fits, Nuance, Zoom, any of these types of technologies would be really good exit for us. So.
Good question.
Thanks, everybody.
Craig and Sam. All of this back matter.
Oh, it's wonderful stuff.
Yeah.
You want to see what we did with J.J. McCarthy? That was cool.
Yeah, I just want to tee up Peter here. It's a great deck, though. I mean, ask him for the deck.
I'd love to send it. Thanks.
Thanks, Sam.
Thanks, everybody.
Thank you, Craig.
Cheers.
Really excited to have Peter Peckoff back from Avana Health. And this is another story of doing your updates. When a startup keeps us investors and prototypical investors and wannabe investors informed of what they're doing, then we can see trend lines. If you're not telling us anything, you're not top of mind. Peter stayed top of mind, has great traction stories to tell. Use the down button to advance the slides. Peter Peckoff with Avana Health. Your 15-minute presentation begins now.
Yeah, thank you, Tim. I mean, it's always easy to touch base with somebody as friendly as David. It's been a pleasure to keep him apprised, and it's a pleasure to be here tonight. So thank you so much, first of all. And launching into this, again, my name is Peter Peckoff. I'm one of the co-founders and CEO of Avana Health. At Avana, we've developed a drug and device treatment system to address a critical unmet need in uterine health that affects 1 in 3 women. I'm talking about abnormal uterine bleeding, which is blood loss outside of pregnancy that affects things like duration, volume, things of that nature. And because of how many women it does affect, it is a multi-billion-dollar opportunity, but I think it's important to also appreciate why we think it's so important to us and some of the problems that exist around it. For me personally, it is deeply personal. So my sister-in-law, she had endometriosis, which can lead to abnormal uterine bleeding. And they struggled with fertility as well. And when she did get pregnant, she developed placenta accreta. That's where the placenta and the uterine wall fuse really tightly together. And so we knew it was a high-risk pregnancy. And unfortunately, at 24 weeks, that ruptured. And doctors had to perform a life-saving hysterectomy for her. But they could not save the twins. And that was awful for our family. And it really brought home, I have a background, 20 years in finance and life sciences development, but it really opened my eyes to just how big these unmet needs are in this space. And then when I was speaking with a family friend, an OBGYN surgeon of 40 years experience, he was talking about how abnormal uterine bleeding, which again is outside of pregnancy, but he's treated all of these conditions, thousands and thousands of cases of them. And in fact, his wife, Angie Moorhead, who herself is an OBGYN nurse practitioner, she suffered from abnormal uterine bleeding for 22 years. Together, they tried everything to fix this problem for her. 8 different kinds of birth control, 3 different intrauterine devices, surgery, none of it was working. And this is a chronic condition, but every time it came up, she's experiencing this really unpleasant, life-derailing acute experience. So she decided to have a hysterectomy. And yes, you know, you remove the uterus, it does remove the chance of future bleeding. But it also means no more children. It also means greater health risks later in life. And so if John and Angie, with their backgrounds, their access to care, can't find a good solution, well, that explains why there's 33 million cases of abnormal uterine bleeding in the US alone per year. And payers are finding it is twice as expensive to cover women that have abnormal uterine bleeding versus those that don't. And so this personal reasons for why we really want to work on this and this widespread prevalence is key to understanding, and I appreciate an investor conversation, and so it's important to translate that to understand, does that lead to a market? Well, it certainly does. So affecting 1 in 3 women, we looked at data from the CDC, the American College of Obstetricians and Gynecologists, as well as individual reimbursement claims data to determine the average number of cases and multiply that by the net revenue per kit to identify globally, this is a $63 billion opportunity. The US represents $19 billion in an available market. And we see emergency departments as a key beachhead, multi-billion-dollar opportunity in and of itself, with an opportunity for $600 million in reoccurring obtainable revenue. Now, as we appreciate the opportunity, we also want to understand, why is this happening? Abnormal uterine bleeding, which is represented here on the left, is caused by 9 different factors, which can make it hard to diagnose, take a long time to diagnose, and each time these things are occurring, it is a chronic condition, but there's these acute episodes happening. And so the way we address this is very innovative because it's agnostic to these underlying conditions. We're using polydocanol. Now, it's a commercially available drug that's been around for a long time. It is used and has a well-understood mechanism of action that stops bleeding locally in 3 minutes or less. Now, it's never been used off-label for uterine indications because there wasn't an effective way to deliver it. So we created a proprietary device. It's sterile, single-use, creates a fluid-tight seal, and delivers it at optimal pressure, not a lot, like 2 psi. And that's also worth noting that the drug is off patent. So we patented the drug and device back together with applications of use included in that patent. Now, addressing acute abnormal uterine bleeding, those acute episodes, represents a real white space. The reason for that is there's no FDA-approved treatment, for acute abnormal uterine bleeding. It's not to say there's no competition, but what's happening is off-label use. Doctors can only rely on these off-label uses of drugs out there, but they're extremely not optimized for that kind of pain point a woman's experiencing at that moment. Specifically, Angie needs the bleeding to stop right now. And so what this does is it's designed to work 100 times faster than those other options, last 40 times longer than those other options, while being hormone-free and fertility preserving. Big differentiators in the broad landscape of this space. And it can be used by doctors or nurses as a quick point of care to quickly improve women's quality of life. Now, to get there, we've talked to drug and device manufacturers, estimating the kit to be around $32. We plan to sell that to hospitals for $700 per kit to be reimbursed by payers. And for reference, emergency departments, which again we see as the beachhead, they're paying over $4,100 per patient per visit. So we've done a lot of economic modeling, it's in the data room. But the point is, it does leave obviously a very large margin at this point and a lot of room to play as we continue this pharmacoeconomic analysis as we go through our trials. Now, to date, we've been really effective and capital efficient, having raised 2 previous rounds for $610,000. One reason we can do that is we enjoy a very big competitive advantage. The drug has been around for 50 years. It's been approved in the US by the FDA, in the EU, and Japan. Those are stringent regulatory authorities that have approved this for things like collapsing varicose veins, treating acute esophageal bleeding, among other indications. So unlike a de novo drug program where it's, hey, you know, we think it might do this, it's gonna be great, but it could also wreck the body, we have no idea. Not the case here. We gotta rely and leverage a lot of data out there. Now to translate that over to what we're doing, we did do that. We did a preclinical animal model. It was a sheep uterine model where we stopped with polydoctanol. We stopped the bleeding in 3 minutes. The saline control bled like crazy. And we analyzed with one of the world's leading researchers in uterine pathology, worked on a lot of other treatment options. And we saw that there was no harm to the non-bleeding healthy uterine tissue. So great, same effectiveness profile, really strong safety, and then we went and we filed a non-provisional patent here in the United States, global PCT. We have plans to file more. We built a world-class advisory board that has actually been very active, very helpful in guiding us and accelerating our program through their guidance and their connections. And I'll speak more on that a little later. But bottom line, it allowed us to create a robust, detailed clinical and commercialization plan. We developed a prototype of the device, did robust economic modeling, and we have ethics committee approval to start our first study. That'll be done in Kenya with the oldest leading research hospital that's not just a thought leader in Kenya, but for all of East Africa, and has been involved in many large multinational studies. Now, leading the charge on this is a team with a collective 175 years of experience in OBGYN medicine, as well as preclinical and clinical life sciences development, past device approvals, drug approvals. These are working in some of the biggest blockbusters out there. We've worked in over 50 countries. We've worked with organizations like the WHO and Gates Foundation. My CSO and co-founder, Michael Royals, is currently working on, or just finished up a big Gates project in West Africa. I'm on a steering committee with the NIH and Gates Foundation, looking at unmet needs in women's health. And then we also have some serious entrepreneurship bonus, having raised over $200 million in the past for other endeavors. That advisory board, I'd like to highlight a couple people here. Katina Dorton, JD, MBA. She focused on life sciences investment banking. 50 billion M&A transactions under her belt. Then switched over to become a life sciences CFO, leading to multiple exits, a couple IPOs. She and I and our current CFO are working very closely together in terms of a few things that I'm going to touch on in the next slide. Dr. Malcolm Monroe, one of the world's leading experts, considered the leading expert in abnormal uterine bleeding. He sort of wrote the book, if you will, for the international standards and classifications around abnormal uterine bleeding, professor at UCLA. Just accolades to Mattel. Then we also have 2 senior ex-FDA officials. One was the gynecology division chief. He's trained everybody that's there. Then it was his counterpoint, Dr. Lisa Soul, OBGYN, working on the drug side, trained many of those. Brittany Barreto, leading voice in femtech and women's health business insights. It's rare for me to connect with anybody in the industry that isn't already connected with Brittany. She sees all of this stuff, but she saw a poster of ours. We're both, we live in the same area, keep running into each other, but she saw a poster of ours and said, I now appreciate how differentiated you are. What can I do to help? And she's like, okay, put me on your board. People got questions, tell them to come to me. I don't do this for everybody, but I really appreciate what you're working on. And then other leading experts in various areas, including postpartum hemorrhage, which we have in our pipeline. That's the leading cause of maternal death, and we see a crossover application there. Where we are today, we're asking for $900,000 to do our study in Kenya and get regulatory approval here in the US to then conduct our phase 2 study here and multinationally. We have a lead investor who's syndicating the rounds based on commitments and then soft circled. We're on track to oversubscribe, but again, we all know You gotta get the money in the door, firm commitments, so we're still taking those. Now, we thereafter plan to do a Series A raise, which will get us the clinical trial for phase 2, 510K for the device approval, and we would file more patents among some other milestones. When we think about exits, we foresee investor exit opportunity arising in the next 3 years. The reason for that is based on comps. There are 3 drugs in sort of the women's health domain that were recently acquired post-phase 2, pre-commercial, pre-revenue, for around $1 billion each. We plan to follow that strategy. Now, I don't want that to be pop-up chatter. When I say we plan to follow that strategy, I'd like to add some meat to the bones there. If we say that, we take it seriously. So I'm working very closely with Katina. We're already engaged with 4 potential strategic acquirers. One VC arm of one of the acquirers has reached out to set up a call. I just flew back last week from JP Morgan Healthcare in San Francisco. That was a 3rd meeting that had been requested by one of the best acquirers. And when I say best acquirers, what I mean by that is Dr. Malcolm Monroe, who wrote the guidance documents for Kaiser Permanente, and he told me, he's like, acute abnormal uterine bleeding, that is your white space. Do not go to FDA without me. I will advocate for you. And as a matter of fact, they need to give you breakthrough designation. I've done this with another client in a different area, somebody that I've worked with. They got to do the same. And I know the chief medical officer and CEO of many of these companies. We went through the book, and he's like, let me connect you here, let me connect you there. With Katina, we're talking about what is the package they need to see, and how do we work backward from that. And she's already connecting us with the investment bankers that will help us with the Series A raise. And she herself even admitted, as strongly as she believes in this, I thought we'd be going to a couple boutiques, but as I start talking to people, some of my colleagues who I was just looking for a referral to a boutique life sciences, some of the big guys actually want to really get into women's health. They see this as a huge growth area, and they feel that this is a really great place to start. So there's a lot of meat on the bones when I say, we see the exit, it's likely from acquisition, it favors the comps, and we're working backward from there. And so I can go on more there, but I'd just like to. So ultimately, what we foresee is that this will be the real, if you will, go-to for acute abnormal uterine bleeding to give patients like Angie a better option, and to, in time, address life-threatening situations for patients like my sister-in-law, Rosie. So I appreciate your guys' time. I'm ending a little early because I love the Q&A side. I want to make this more of a conversation. So please, by all means.
Peter Paycole. And I'm going to give you your minute back on Q&A.
Okay. Appreciate it.
I have a quick question.
Yeah,
So
please.
is this like repurposing the existing drug that has been used for other applications, but you're just repurposing it for different ones, so you will see a shorter trial period?
Yeah, that is correct. We get to leverage some of the data that's already familiar to these agencies. That brings down cost, that brings down timeline. And when we talk about timing, it's important to also say that there's a real strategic advantage to doing acute abnormal uterine bleeding. Those previous studies, and there's only 4 of them, again, Dr. Monroe, this is not a good place. There's huge unmet need. Those studies range from 5 hours to 7 days. So the clinical study can be much shorter. I've worked on those sand traps of really long studies, so we're very aware if we can keep that duration of the study shorter, that is to our advantage to also keep costs down too. And get to approval faster.
Scott?
Actually, I didn't know.
Oh, okay. I have one for you.
Yeah, please, David.
And if you could go back 2 slides.
Mhm.
You've had a lot,
Ooh.
3 slides.
This one?
No,
This one.
forward. You've had a lot of good coaching on your fundraising track, the A-round slide.
Oh, yes.
Is there an opportunity to do a bridge to A, include some more angel class investors, or does a corporate plan on taking out most of that? Talk
So-
about this pathway.
Yes. So this is a question that's been asked of us a couple times.
What did you tell the last guy?
In the last couple months. And so what people have said to us is, we're very interested in this. We actually like to write a little bit bigger of a check. And so there's multiple parties that have asked, hey, if you want to do a seed plus round, we'd be very interested. And so we're talking with them, as well as we have filed for a number of grant opportunities in the pipeline.
C
so that-
plus is bridge to A.
Yes, thank you. So we have a few that have asked about this and would like to do it, and we also have some non-dilutive funding that we're looking at too, that could kind of be in between these areas.
Because, you know, anticipating Jimmy's next question, that's a big jump.
Sure, yeah.
Greg and then Aaron.
Oh, and the reason for that jump though,
Greg?
is we'd like it to be the last time we need to raise money to position ourselves for that, so, yeah.
That would be nice.
Yeah.
You don't always get.
So after application of the product, what's the duration of the benefit that you receive?
So we anticipate the working hypothesis is 60 to 90 days. And we'll continue to study that in the study.
So it's, okay, so this is done in an acute setting because of an emergency or something, but there's a lasting benefit that's, okay.
And it could bridge to current standard of care. And in a post-market situation, we would look to add on to the label, hey, this can last this long. And it could be used sort of in that more chronic care condition, opening up
Okay,
an even bigger.
That
and
was
another
more
more
my, that was more my question. Is this
Yeah.
something that providers would be using for chronic as well as acute?
Mhm. Yeah, thanks, Fred. Great question.
Is
Yeah.
that specific, oh, I'm sorry, is that specific for your drug? Or is it, can you use TXA with it, other anticoagulants?
TXA is one that is used currently.
But can you use it with your?
Oh, in combination
Yeah,
with?
no, or instead of, or is it
Get it
just
out.
your drug?
Ask one more time. I'm sorry.
So
I'm not sure.
the device delivers the anticoagulant,
Yes.
just that drug,
Yes.
only, you can't like substitute TXA, can you?
You could use other drugs in the delivery
Off-label?
device. And you could do it off-label. TXA is currently used intravenously,
Mhm.
and this would be an infusion into the
Because we use a
uterus.
topical as well too, for different things, because you can't use a topical, it's
Yeah.
approved, but yeah.
So you could, yeah. It's in many ways, the device itself is going to be a general purpose uterine catheter.
That's what I was at, yeah,
Yep.
so, okay, that's
Yeah.
that's important.
That was a great insight from Colin Pollard at FDA.
Yeah.
He just said, I don't think you have to go combination product for those that are
I
familiar with
think
these
that's
paths. He said,
that's your place.
yeah,
Okay.
thank you. Great question, Ken.
Michael, did you have? Kurt?
What do you need to show with the capital from seed round to get the step up in valuation? What's the unlock?
Yeah, great question, Ken. Thank you. Or not Ken,
Kurt.
it's Kurt. Yeah, thanks, Kurt. So this phase 1 study is going to give us a lot of valuable data that can apply broadly to whatever comes forward thereafter. There's safety data, there's an efficacy signal. I can get into the weeds on that happily, but bottom line, that's big, important milestones. In life sciences, that's a huge valuation jump. Comps support that. JP Morgan healthcare data supports that in a big way. And then we would also get regulatory approval so that we are essentially mission go to start our phase 2 study with Series A capital. So that's also very helpful. Those are, again, data room supported comps and things like that show how you can get a 2-3x jump in valuation quite easily from those.
How, I guess, without getting into the full breadth of it, but just more specifically, literally, what do you need to show? Like, that it's safer,
Mhm.
the safest?
Okay, I understand your question.
That it's stop, like, what do you need to shape these studies to show?
Mhm.
And then, are you raising the capital to run the experiments that deliver those results?
Yeah.
You know, in the number of times you're budgeting to run them,
Mhm.
basically.
To answer the second question first, the answer is yes. There's enough to do that. There's a few reasons why we went to Kenya. On the financial side, it's 15% the cost of doing a study here. To your other question, what are we collecting and how does that matter? So we're collecting safety data, first and foremost. So when the drug's in the system, how long does it last in the system? How does that work? That's important to understand. By the nature of how it works, we get an efficacy signal. Does it stop this? Now, we're treating patients there that are scheduled for a hysterectomy. And so that means that they've failed other treatments. They're trying this. They're still going to have the hysterectomy. But a lot of times these women are at risk of anemia. So a lot of blood loss, iron deficiency. If we can also help reduce the amount of, say, blood transfusions they need, clinically that is very relevant and would be really helpful. We'll get a signal on that too. And then because they have a hysterectomy, and again, we've been the really great beneficiary of a lot of wonderful guidance from key opinion leaders in the space. They said, because you're working with patients that have the hysterectomy, you can actually look at the uterine tissue after it's been removed and analyze that for safety measures too. So as we move forward, we're pretty much taking a lot of safety risk off the table forever. And again, we operate with a pretty high degree of confidence because of how robust 50 years of safety data exists for all the other indications. Does that give a little more flavor to it?
Yeah, and I'd like to talk to you.
Okay.
Jumping in on a 510K question.
Yeah, please.
Just because it would be great if you could skip that risk.
Mm-hmm.
It's nice to have folks speaking on your behalf to the FDA. The FDA does what the FDA does.
Sure, sure.
Is there a device currently, intrauterine applicator, that is 80% of what you need?
Yeah.
And you could use it to get to market faster?
We do have a predicate device.
Go.
Yes.
No, not a predicate device. That's for the 510K. I'm talking about an existing marketed device that you can use this drug with without having to go through the 510K at all.
That's a kind of tricky question in the sense that.
Well, they already asked all these ones.
Yeah. It's a nuanced question. Let me try to be succinct.
Go.
So there are things we can use off the shelf to create a bit of a Frankenstein that kind of gets us in the ballpark.
We call it off-label use, not Frankenstein, but yeah.
Sure. So off-the-shelf components can be bridged together, but it would be suboptimal. Now, part of the benefit of what we're doing is we have a very easy-to-use, streamlined device that also has patent protection. Now, we've talked with our IP attorneys. If somebody tries to do what we're talking about, it would infringe on the patents. There's a moat around that. I can get into more details there. But there is the long pole in the tent. If I think I'm trying to answer this to the heart of the question. The long pole in the tent is not going to be getting the device approved. It's doing the drug trial. So that's the really important part. The device is a pretty straightforward path in shorter, and we can get that approved sooner. That would happen sometime in 25, early 25.
You and I had a conversation last year about the trial in Kenya and the results that then are used in regulatory regime outside of Kenya. And that turned out, I didn't know this, to be quite the beaten path. Can you describe just at a very high level, how does that accelerate your path to market?
Yeah, sure. So our team has a strong background in global health. So we know one of the research teams in Kenya, that's kind of how this came about. We have a strong desire to make sure that this is applicable in low and middle income countries as much, or let's say low resource settings, which would be applicable here in the United States too. Now, everything we're doing in Kenya, we would do here in the United States, meaning it's good clinical practices. It's sort of the quality assurance program that is wrapped around this. We're doing informed consent with the patients, ethics committee approval from the hospital. So everything that we would do here, we're doing over there. And it's a gold standard study, meaning it is a controlled, double-blind, randomized, placebo-controlled study, things of that nature. Again, done there, same as we're doing here. So by doing that, we can do it faster, for less money, and also get a lot of really good insight into environments that are more accustomed to low resource and have higher patient volume. Because again, there's a really large hospital feeder system for a really big area. So those are some of the advantages.
How much money would you need now to skip Kenya, use somebody else's device, and do the trial here? Because I look at that, I'm like, if it's just go to Kenya because you saved 70%, right? Well, if you had more money today, you didn't have to develop the device and get a patent, screw that. Could you do everything right now? Because you say you want to do, get the Series A and an exit quickly, why not bypass all the BS, speed up everything today? Is it that much more money? Is it 5 times, or is it
money and time?
I know, but you solve those problems. I would think if you have somebody else's device that can work, and you don't go to Kenya, I would think you can accelerate this by 500%. Am I wrong?
We still have to do the same study design, just here in the United States. And so at this point, we have approval to start that study. We can start dosing patients late end of February. And we still have to then do regulatory approval for this study and then the phase 2. And so I can give you a dollar amount, but the answer is still going to kind of come out to the same process plan. Yeah. And again, exit strategy here is not to go all the way through these clinical studies. It's to get proof of concept after phase 2, and that's heavily supported by the comps and the industry trends today. Yeah, but it's a, Jimmy, I mean, it's a very fair question, and I like the strategy of like, why this over that? Yeah.
Yeah, just one clarification. You mentioned that you filed a non-provisional patent and a PCT, and then you said that you've got patent protection. So do you have anything issued yet, or is it just filed?
It's patent pending.
Patent pending. Do you have any timetable or any, guidance from the attorneys? I mean, we might have any indications of whether the outcome looks good on that application?
We should have those over the next couple of years. It's just kind of working on it. Part of it is how hard do you want to push to, how much money do you want to throw at it right away, that kind of thing.
Yeah, I'm just trying to map out what the exit is gonna acquire is something that they can, protect for
Yeah.
their scale. And I'm trying to understand that pathway to value creation alongside the clinical trials you're running with this, with preclinical, I guess, with this.
I do have a really relevant anecdote to that. So I know the former VP at Stryker who handled their business development and intellectual property strategy. And I talked at length with him about that. And he just said, so long as you've done the patentability search, you've got the patents pending, patents approved, patents pending, we're going to do our own research one way or the other, because you could get a shitty patent approved. And if we think it's bad, then what does it really matter? But he's like, do you have patents pending and you're working with a really good firm? And Fox Rothschild, he's like, oh, I know that team, they're good. He's like, yeah, no problem. And he also really liked what we're doing. He knows the Stryker CEO went over to Hologix. They're the most active acquirer in women's health. And he's like, after the phase 1 data will be perfectly timed, I'm going to introduce you to him. And he's like, I also know another CEO of a company that you should talk to. So that was a good conversation. Yeah.
Other questions for Peter? Peter's going to stick around afterwards, as all our presenters will. Let's give it up for Peter and Avana.
Great questions, everybody. Really appreciate it. Thank you. Of course, yeah, that's it.
I got to figure out where. Oh, here we go. We had a really great preview, which led to Avana. We had a really great, thank you, venture presentation from Ecovia Renewables. So great that we added them. That was one of the 6 companies we added to the portfolio last year. Here to tell us what's up at Ecovia. You say Saeed, founder and CEO. You say your 5 minutes begins now.
Thank you. Thank you all, I appreciate it. This is just a refresher. What do? We make low-cost, bio-based, biodegradable polyglutamic acid that is a replacement to polyacrylates. If you're in chemistry, you know what I just said. Otherwise, I can
For the rest of
explain
us?
it. Otherwise, I can explain. Well, there's a proxy for this. Let's take xanthan gum or cornstarch as an example. Those who make it have a number of different applications. If you're in xanthan gum, it goes into cosmetics, it goes into food, it goes into baking, it goes into oil and gas, believe it or not. A number of different applications out of a single ingredient, and that's what we do. We make a single ingredient, low cost enough that now new applications are opening up. So previously, no one looked at those applications because the price points were about $200 a kilogram coming out of Japan and China and Korea. Our advantage is $5 to $10 a kilogram, so all kinds of new applications open up for us. When we came last year, I think it was May of last year, when we pitched, the whole idea was we needed money for working capital to support an order we made with a Japanese company for $300,000. Our thesis at the time was that we were going to use outside companies to make it for us, or essentially outsource manufacturing in fermentation, and then also we wanted to get the product market fit essentially crystallized for us going forward. What we discovered throughout that exercise, and of course, Jim, thank you for the investment. We did have a major investment from Jim, and we were pretty pleased with that. But what we discovered through that exercise is the idea of going out to the market for manufacturing is not a smart idea. The fermentation market altogether was sold out. They're either making alternative proteins for the food industry, or the price points were significantly higher than we had expected. So, but what we did with the money also, we were able to find exactly the areas where we wanted to participate. I mentioned the product market fit. We were able to build Azura base, which is our linear version of polyglutamic acid. Azura gel is the cross-linked version of it, and that's the derivative. We built in certain features in those two products, these two product categories. Those features were aligned with the benefits that the customer applications needed, and ultimately the customers are signing up to purchase those materials from us. So in the case of customers going forward, looking ahead, we have to build sufficient capacity in our facilities in Ann Arbor, Michigan, to serve these markets today, because the capacity that exists outside of our reach essentially is sold out. And so what we're focused on now in 2024 is making Azura base, making Azura gel, and essentially closing the deals that we have with these customers. In all of these cases, we're price volume negotiating right now. Unicharm already purchased $300K from us. Noriam, BASF, and Dow, we're negotiating on volumes and price. The same thing for 3M and 3B Sigma. And where are they going? They're going to applications that you're pretty familiar with. Our material can be a tremendous replacement for either hyaluronic acid or an augmenter to hyaluronic acid in terms of humectants. So it's a great moisturizer. You'll see that in the market. Today you see hyaluronic acid, which started out 20 years ago and no one knew what it is. Today it's a $9 billion market. You find it in shampoos and fillers and wherever you touch in terms of personal care. So this is a huge area for us. Hair fixative, don't laugh. That's also a great application, and the reason for it is because of film forming sunscreens. Sunscreens has not had any advancements in the market for a number of years, since the 90s. In fact, even Congress is getting involved in sunscreen developments, because a lot of the sunscreens today that lay claim to having certain SPF don't actually perform. It's like saying the house is fully insulated but the window's down, because the film forming capability of those sunscreens doesn't really exist. And then, of course, the hygiene is the biggest application that we're targeting. Hygiene is things like diaper, feminine care, a number of different medical device applications. So our focus is building internal capability to produce Azura base, internal capability to produce Azura gel, close these early demand customers, and go out for the next round. I unfortunately cannot stay. I do have a client at 7 o'clock with a Japanese call with them, but Jim is inside our company in a pretty good way. He can talk to what we're trying to do if you have any questions. Okay, thank you.
Thank you. Angel added value from Jim Agley. Thank you, Jim. We had such an exciting presentation last fall from Anorak and Electric Fish. You're just back from CES to tell us all the great stuff that you've done since last fall. Please welcome Anorak Kamal.
It was not going proper, not allowed, so this is a spreadsheet of the system, which I'm going to talk about.
Put that over.
Yeah. This is another one. So hello everyone, I'm Anurag Kamal, the co-founder and CEO of Electric Fish Energy. I am, previously, before I founded the company, I worked for the Department of Energy and BMW. And I'm also an alma mater from Michigan Tech. Definitely want to congratulate everybody for the consecutive good bourbons. It's been definitely a fun time. I think Lance won this game, the kickoff game, only the last time they won it was before I was born, so it was a long time. The company Electric Fish since I pitched in September, has made really big strides. We have sold or issued pre-orders for 1 million worth of products, 6 of these units, and have built a pipeline of 16 million in sales by the end of this year. And the products, the Generation Jody, is what we're selling. The key customers who we are working with right now are electric vehicle fleet operators. So car dealerships, electric vans, depots, and the companies which build infrastructure for them, and they are the ones which are in pain. Currently, it takes more than 2 to 3 years to upgrade the existing infrastructure, to put a super fast charger there. And once you're married to the site, you dug the ground, you install the infrastructure, you are hit with hidden costs of permitting and high operation costs because of the peak cost of electricity. And now you can't do anything about it. This whole problem is boiling all the way up to automotive OEMs who are not able to sell product, their dealers are not carrying inventory, and people are not buying EVs. And the whole EV revolution at this point is in danger. The market is ripe for a product like Electric Fish. We have made it so simple for everybody to adopt this product. The form factor is a containerized one. You can drop the unit and you can remove it if you are not happy with the product. And it uses a big battery to store only the energy which you have available at site. So you don't have to upgrade the infrastructure. You can just drop the unit, store the energy in the battery, and then use that battery to deliver the fastest charging sessions which are available in the market right now, which is 20 miles per minute, as fast as it gets. We also have secured key partnerships, Kia being one of them, while looking at our product for car dealership. We deployed in their biggest car dealership and are currently deploying it at the headquarters in Irvine. We also have Disney and Netflix partner with us to deploy this product to serve their fleet of electric vans. And we also are doing demonstrations with Department of Homeland Security for using this as a critical service which keeps the EV charging up while there is an electrical outage. We also became the first DC fast charging company in the world to actually generate revenue from the grid last year in December in New York City, $10,000 over the 3-month period. And currently we are just scaling up production. That's why we're raising the money for. Me and David are hosting a Zoom meeting next week for bringing this money together. The key utilization of this is to get our UL certification and deliver on the commercial pilots, which we have signed on right now, so that we can realize that 60 million worth of order, which are contingent on delivering these commercial LOIs. So with this, I'll end my presentation early, and I'll be around for questions.
Thank you. I want to beg your indulgence because we got a few more updates from portfolio companies. Baru, which we previewed in October, is expecting first revenue actually this month. This will be the first revenue for a new venture, so that's a pretty exciting milestone for Baru. And we were able to connect Baru with Motor City Granite and Cabinets, who were here to visit Free Power when they presented back in November. That connection turned out to be very valuable for Baru. That's going to be their new training center for Baru's dealer network. And they are raising an angel round. They expect organic growth. This will be the only round for Baru. Culture Well, which I spoke with a couple of folks about earlier this evening, is rocketing through its raise. It was a 3-tranche, $3 million raise. They've raised 2/3 of their money. And the strength of participation from the local angel and early stage VC community has just been phenomenal. I credit the leadership team of Sarah Beatty and Jen Baird for really working the phones and working the investors on this one. And that was interesting. Two big news from thanks, Peter. From Culture Well, and that is they closed Trinity Health, that's a dozen participating hospitals, and they closed Aramark, which is hundreds of hospitals where they can provide their cleaning and hospital-acquired infection early warning system. Freight Roll is a portfolio company, and we were looking at them through the wrong end of the telescope.
Honestly, they looked so much like a service provider that we were wondering if they were ever going to scale. Well, guess what? Blue Triton, formerly known as Nestle Waters, has got them with 1,000 drivers today, with 2,500 shipments today, and they're going to add 20 more facilities this year. That'll be 700,000 shipments for their digital transformation product that does digital bill of lading and gating. So they are hitting the elbow in their hockey stick. These numbers should get Jimmy or any other investor scratching their head about 125. They're 10xing every year. Oversubscribed their last round. I don't know if they're ever going to raise again.
I'll just add that they have 2 venture firms in there now, and things look good.
Nice turnaround, huh?
I
We were
had my-
scratching our heads on this.
I had my doubts for
You
a
had
minute.
your doubts, all right, well. And anybody who had their doubts about innovative billboards, their full-scale model in India is now changing slides. A 14 by 48 billboard is a slide for them in a second.
I thought they were
One
here.
second.
Oh.
The manufacturing is in India.
Oh.
It will be here in 3 months, and I think that's the invest point for their next round. They've not signed any of the 3 largest networks, but one of them sits on the board, so I'm pretty sure they're going to get Adams. Outfront Lamar and Adams is a good chunk of the billboard market. There is 250 available in the raise that we participated in last fall. MOX AI, one of our June presenters on the, if you remember this meeting, it was the AI heavy meeting. MOX is doing autonomous closed circuit TV surveillance, so we see the cameras everywhere. Who's actually watching that? A robot. What is the robot watching? He's watching shoplifting and employee theft. Royal Ozarks, which builds a lot of these convenience stores for BP and for Sunoco and other brands, has got them in 70 stores. That's going to ramp 3x this year to 250 stores. And they got a very nice follow-on investment from Techstars. Everybody in Techstars gets the 120,000, that's table stakes. But then they won the 250K prize at Techstars as well, and they're raising $1 million pre. Nanotherm, which presented last October, we have our subject matter expert on Nanotherm sitting over here with Ken Helfrich. Angel added value there. He's joined their advisory board. Nanotherm has shipped their first unit to Hyundai, and it's got every single one of their panels that they ever want to commercialize in automotive. It's got the surround heat cabin, it's got the heated windows, it's got the heated wiper trays, and they'll be sampling to GM and Stellantis this year. Their safe notes are moving through Ohio Angels and through Sand Hill Angels. We need to get some more angel money out of Michigan into this one. Please point your phones at the screen. It's time to play Carp Tank. Carp Tank is our gamified investor application, and what you'll find when you open up the app is the 12 companies that we looked at today. That's 2 previews, 2 venture presentations, 2 live updates, and the 6 that I just went through. And Carp Tank is going to give everybody $1 million, and knock yourselves out. Figure out where that money needs to go. Angela, get out your phone. Come on, everybody's playing this. Kristen, you're up. Those of you who played Carp Tank before, you've probably still got it in your phone. If you don't, that will load it up for you. No stragglers now. Here are the companies that we'll be betting on today.
So is this averaged out? Should I be playing 2? Just kind of tip the scales?
Well, we will take your results out, but I mean, if you want to play, play. It's an investor game. You want to be an angel, you're going to have an exit here. So.
I'll cycle back in.
So I'm going to give you a couple of minutes, but I want to do a shout out to Ted Metry. Where's Ted? Ted won the Spirit of Pointe Angels Award in November with the bets that he made on Carp Tank. And the way he did that was by predicting the room. His bets were the closest to the room's consensus on what looked good. Now, there is no expert in this room. Everyone is subject to the 7-2-1 rule. Broad portfolios is your best hedge. But your second best hedge is safety in numbers. So when we all look at all of these deals, we all get smarter. Take a couple minutes and play Shark Tank, and I'm going to toast Ted Metri's success with the deal bomb. Now we've got a couple other pours today, but we're just starting with that.
Ooh. Our friend Jay. Very nice.
Yeah, he's tough.
He's tough.
So it's getting this bottle.
Excellent.
Any company exits gets the bottle.
Well, we have investors in Lexington, given that brings them up from the source.
There you
Oh,
go.
yeah, I think it's the same juice.
Yeah.
Do they have anything better?
I don't know. I think that's pretty
Everybody got the QR code. I have to leave that up there. The companies are all click in the upper left-hand corner, place you bet. The tradition of the deal bottle goes back to the origin of this august organization. And I'm offering this to my friend and colleague, Jim Agley, for his investment. And
So you may need a straw.
Well, not yet, but.
no drink for you, though.
Yeah, I was gonna say. I'll take a drink for good intentions.
There you
but
go.
They haven't closed it yet.
Did I miss any investments since November? I've been known to be out of the loop. That? This one's for you. Oh, he's still playing? All right. Well, this one's for me. Everybody place your bets? That's still working. He's going to go for two.
I'm going for two.
Chad, what's the answer?
I have no idea. I placed my bets.
Yeah. You get, well, $1 million. Up to $1 million. You have $1 million bets.
Just your success. The success of your venture. Thank you. Next month, the Country Club of Detroit is closed the third Wednesday, so we've moved it out a week. We are meeting next on February 28th instead of the 21st. And your homework assignment, because nobody gets out of Professor Bloom's class without one, is figure out who belongs in this room.
Mm-hmm.
Figure out who should be here, who isn't. And bring them. Thank you. We stand adjourned.